Hi, my name is Dragana Skokovic-Sunjic, and I'm a clinical pharmacist working in a primary care setting. In this video, the first of a three-part series from the AEProbio Professional Discovery Academy, made possible through unrestricted educational grants from Align, I will discuss how we, as medical professionals, can understand and support our patients during their IBS journey from diagnosis to ongoing management. Because irritable bowel syndrome is one of the most commonly diagnosed gastrointestinal conditions in clinical practice, most of us will see patients with IBS on a daily basis. Like you, I frequently support some of the more than 5 million Canadians living with the often frustrating and unpredictable symptoms associated with IBS. One in 5 Canadians experience symptoms of IBS. While the majority of people will experience at least some of the gastrointestinal symptoms periodically throughout their lives, those with IBS may experience the associated symptoms more often and at a higher intensity. IBS affects how contents move through digestive tract as well as how the brain interprets sensations that occur along that journey. Although the exact cause is still unknown, it is believed that IBS may be triggered by infections, food poisoning, change in diet, bacterial, hormonal, or neurotransmitter imbalances, travel, medications and surgery, and biological differences, meaning that IBS is diagnosed more frequently in females than males. IBS can affect anyone, but it tends to peak in those who are in their 30s and 40s and declines after 60 to 70 years of age. Symptoms of IBS include abdominal issues, often associated with changes in bowel movements. Symptoms are often unpredictable and can make patients anxious about the next flare-up. Other IBS symptoms include abdominal pain and cramping, constipation and/or diarrhea, abnormal stool frequency, bloating, excess gas, and flatulence. IBS symptoms can impact an individual's ability to work, to attend school, to take part in social activities, sports, and relationships. While symptoms are generally not life-threatening, many factors associated with IBS can significantly impact quality of life. 46% of patients with IBS missed work or school due to the symptoms. Because it's considered taboo by many to talk about digestive symptoms, many individuals with IBS suffer in silence. On top of that, being a functional disorder, an ailment that doesn't have physical signs of damage, many patients feel they are not heard or understood. IBS can be frustrating and time-consuming for those of us providing care for our patients. We need to provide our patients with space and time to tell their story. We need to listen to understand, not to interpret and react. On average, patients can actually provide all pertinent information within 90 seconds, and by listening with understanding to their stories, we can provide the guidance and help they need to manage their IBS symptoms. So now that we know a bit more about the clinical presentation of IBS and recognize how frustrating and troubling it can be for our patients, be sure to watch the next video in our series where we explore safe and effective therapeutic options.